Today, we learn about beta blockers plus diabetes. For clinical practice, it's important to understand how beta blockers affect diabetes. In this topic, we cover how beta blockers mask the hypoglycemia warning signs in diabetes. Why is this important? Which beta blockers are preferred in diabetic patients? How to educate the patient. So, how do beta blockers mask the warning signs of low blood sugar in diabetic patients? Well, beta blockers are mainly used to control blood pressure by blocking beta receptors in the body. Now, if someone has diabetes and is using insulin or medicines like sulfonylureas, their blood sugar can sometimes drop too low. Normally, when blood sugar drops, the body releases adrenaline. This adrenaline activates certain beta receptors, which cause early warning signs like shaking, a fast heartbeat, or feeling nervous. But, when a patient takes beta blockers, these receptors are blocked. As a result, these early warning signs are masked, and the patient may not notice hypoglycemia until it becomes severe. Move to the next part. So, why is this important? Well, if someone doesn't get those early warning signs of low blood sugar, like shaking or a fast heartbeat, they might not treat it in time. And, what happens then? Their blood sugar can drop dangerously low. That can cause confusion, fainting, seizures, and in the worst cases, even death. It's especially risky for people using insulin, like regular insulin, rapid-acting insulin such as Lispro, or Aspart, or long-acting insulin like Glargine. It's also risky with certain diabetes medicines, mainly sulfonylureas, for example, glimepiride, gliclazide, or gliburide, because these medicines can also lower blood sugar. So, understanding this risk helps keep patients safe. Move to the next question. Which beta blockers are preferred in diabetic patients? Doctors usually choose cardioselective beta blockers because they mainly target the heart and are less likely to block the body's warning signs of low blood sugar, like shaking or a fast heartbeat. Examples include atenolol, metoprolol, and bisoprolol. In contrast, non-selective beta blockers, like propranolol, affect the whole body and can hide early signs of low blood sugar, so they're usually avoided in diabetics. Sometimes, vasodilating beta blockers, such as carvedilol or nebivolol, are used in special situations under a doctor's guidance. Now, what does in special cases mean? It means that sometimes, a patient's health condition is unique, like having both diabetes and heart failure. In those situations, the doctor might still choose a medicine like carvedilol, even if it's not usually recommended, because the benefits are more important than the risks. Our next question in this topic is how to educate the patient. First, help them recognize symptoms like confusion, blurred vision, or dizziness. These signs can still appear even if they're using beta blockers. Encourage them to check their blood sugar regularly, especially during exercise, or when their medications change. Remind them to always carry something sweet, like glucose tablets or juice, in case their blood sugar drops. And finally, stress the importance of taking medications on time and telling their doctor about everything they're taking.